What if I told you that diabetes isn't just about high blood sugar? What if the real danger starts years before most people even realize something is wrong? And what if a few everyday habits could quietly increase your risk of heart disease, vision loss, kidney damage, or even amputation? If you think diabetes is simply taking a pill when your sugar is high, you may be missing the bigger picture. Stay with me, because what you're about to learn could completely change the way you think about diabetes. In this video, we'll break down what diabetes really is, why it affects far more than your blood sugar, and why understanding it early can help you avoid some of its most serious complications. Let's get started. One of the biggest misconceptions about diabetes is that it's just high blood sugar. Many people think, my sugar is a little high. I'll take my medicine, avoid a few sweets, and everything will be fine. That sounds reasonable, but it's only part of the story. According to our expert, diabetes is much more than a blood sugar problem. It's a metabolic disease. That means it affects how your body processes and uses energy. When your metabolism isn't working the way it should, the effects can spread throughout your entire body. Instead of damaging just one organ, diabetes can affect nearly every major organ system. Let's look at what that means. Your brain. Most people don't connect diabetes with the brain. But when blood sugar stays high over time, it can increase the risk of stroke. That's because diabetes can damage blood vessels throughout the body, including those that supply the brain. Healthy blood vessels help deliver oxygen and nutrients. Damaged blood vessels can make that process much harder. Your eyesight can also be affected. Some people notice blurry vision that comes and goes. Others may develop more serious vision problems over time if diabetes isn't managed well. In some cases, vision loss can become permanent. That's why regular eye exams are an important part of diabetes care. Your heart. Now let's talk about one of the biggest concerns. Heart disease. Heart attacks remain one of the leading causes of death worldwide. According to the discussion, diabetes is one of the major conditions that increases the risk. Why? Because diabetes can damage the arteries over time. As plaque builds up inside the arteries, a process called atherosclerosis, the blood vessels become narrower. When blood flow is reduced, the heart has to work harder, increasing the risk of serious cardiovascular problems. That's why managing diabetes isn't only about lowering blood sugar. It's also about protecting your heart. Your liver plays a major role in metabolism. When metabolic health begins to decline, fat can build up inside the liver. This condition is commonly called fatty liver. Many people don't realize they have it because it often develops quietly, without obvious symptoms. Your pancreas. The pancreas is another key organ. It's responsible for producing insulin, the hormone that helps control blood sugar. Over time, especially in certain forms of diabetes, the pancreas may become less effective. The expert describes this as the pancreas becoming burned out, meaning it struggles to keep up with the body's growing demand for insulin. We'll explain exactly how that happens later in this video when we talk about insulin resistance. Your kidneys. Your kidneys filter waste from your blood every single day. When diabetes damages these delicate filtering units, kidney disease can develop. This is one of the most serious long-term complications of diabetes. In advanced cases, people may need dialysis to do the work that healthy kidneys normally perform. That's one reason doctors stress the importance of catching diabetes early and managing it consistently.
Blood vessels and nerves. Diabetes doesn't only affect organs. It also affects the tiny blood vessels and nerves throughout the body. Many people with diabetes describe symptoms like burning sensations, tingling, numbness, pain in the feet or legs. These symptoms happen because long-term metabolic problems can damage both nerves and blood circulation. Poor circulation also means wounds may heal more slowly. Why foot problems can become serious? Here's something many people don't expect. A small cut on the foot can become a major problem. If nerve damage causes you to lose feeling in your feet, you may not notice a blister, scrape, or injury right away. If poor circulation also slows healing, that wound can become infected. In severe cases, untreated infections may lead to amputation. That's why people with diabetes are often encouraged to check their feet every day, even if they don't feel any pain. Diabetes is a whole body disease. After hearing all of this, one thing becomes very clear. Unlike many conditions that mainly affect one organ, diabetes can influence nearly every system in your body. The brain, the eyes, the heart, the liver, the pancreas, the kidneys, the nerves, the blood vessels, even your feet. That's why treating diabetes isn't simply about lowering one number on a blood test. It's about protecting your entire body for the long term. So what actually causes diabetes? Now that we understand why diabetes is so serious, the next question is obvious. What actually causes it? Why do some people develop diabetes while others don't? Is it only because of sugar? Is it caused by genetics? Does body weight matter? Or is something else happening inside the body long before blood sugar starts rising? The answer surprises many people. To understand diabetes, we first need to understand insulin and how your body responds to it. And that's exactly what we'll cover next. What really causes diabetes? Understanding type 1, type 2, and insulin resistance. So now that we know diabetes can affect almost every part of the body, let's answer the question most people ask first: what actually causes diabetes? If you've spent any time online, you've probably heard a lot of conflicting advice. One person says, never eat carbs. Another says, fruit is the problem. Someone else says, just avoid sugar. It can get confusing fast. To understand what really happens, we first need to understand one of the most important hormones in your body: insulin. What does insulin do? Think of insulin as a messenger. Every time you eat, your body breaks food down into nutrients. As your blood sugar rises, your pancreas releases insulin. One of insulin's best-known jobs is helping move glucose from your bloodstream into your cells, where it can be used for energy. But according to our expert, that's only one of insulin's many responsibilities. It's involved in several important metabolic processes throughout the body. When insulin isn't working the way it's supposed to, your entire metabolism can begin to suffer. Type 1 diabetes. When the body stops making insulin. Let's start with type 1 diabetes. Although it's less common than type 2 diabetes, it's important to understand because it's very different. In type 1 diabetes, the pancreas can no longer produce enough insulin. Inside the pancreas are specialized cells called beta cells. These cells make insulin. In people with type 1 diabetes, those cells are damaged, often because of an autoimmune process. In simple terms, the body's immune system mistakenly attacks the very cells that produce insulin. As a result, insulin production drops dramatically or stops altogether. Without insulin, the body can't properly regulate blood sugar. That's why people with type 1 diabetes need insulin therapy. It isn't optional, it's essential. As the doctor explains, insulin is a life-sustaining hormone. When the body can't make it, it has to be replaced.
How type 1 diabetes is often discovered. Many people with type 1 diabetes become sick very quickly. Sometimes they're diagnosed only after developing a serious complication called diabetic ketoacidosis or DA. In these situations, blood sugar levels are often extremely high, and emergency medical treatment may be needed. Before that happens, the warning signs can seem easy to dismiss. A person may feel unusually tired. They may think they're simply overworked. Or they may assume they're fighting off a minor illness. That's one reason recognizing symptoms early is so important. Type 2 diabetes, the most common form. Now let's talk about the form of diabetes that affects most people. Asterisk type 2 diabetes. Unlike type 1 diabetes, the body is still making insulin. In fact, during the early stages, it often makes more insulin than normal. That surprises many people. So if insulin is already there, why does blood sugar still rise? The answer is insulin resistance *. What is insulin resistance? Imagine a parent asking a child to clean their room. The first time, the child listens. The second time, it takes a little more encouragement. Eventually, the parent has to repeat the request louder and louder just to get the same response. According to the doctor, insulin resistance works in a similar way. At first, your body's cells respond normally to insulin. Over time, they become less responsive. So the pancreas tries to solve the problem by producing even more insulin. For a while, that works. Blood sugar may stay in the normal range because the pancreas is working overtime. But there's a downside. The pancreas can't keep increasing insulin forever. Eventually, it becomes exhausted. The doctor describes this as pancreatic burnout *. Once the pancreas can no longer keep up with the body's demand, blood sugar begins to rise, and that's when type 2 diabetes becomes much more noticeable. Why doesn't this happen overnight? One of the most encouraging parts of this discussion is that type 2 diabetes usually develops gradually. It doesn't happen in a single day. Before diabetes develops, many people go through a stage called prediabetes. Think of prediabetes as an early warning signal. Your body is telling you that something is starting to go wrong, but there's still time to act. According to the expert, this period may last for several years. That's why early testing and lifestyle changes can make such a big difference. The sooner the problem is recognized, the better the chance of improving metabolic health before diabetes becomes more advanced. Is obesity the only cause? Many people assume only people who are overweight develop type 2 diabetes. The expert says that's not entirely true. Excess body weight can have a major impact and is an important risk factor. However, type 2 diabetes can also occur in people who don't appear overweight. This is something doctors see regularly, especially in certain populations. That's why appearance alone doesn't tell the whole story. Someone who looks healthy on the outside can still have metabolic problems developing on the inside. What drives insulin resistance? So what causes insulin resistance in the first place? Several everyday lifestyle factors may contribute. One major change over the years has been the growing popularity of ultra-processed foods Convenient packaged foods, fast food, and heavily processed carbohydrates have become a regular part of many people's diets. When these foods are eaten frequently, they can lead to repeated insulin release throughout the day. Normally, insulin rises after a meal and then falls again. But if someone is eating or snacking constantly, insulin may stay elevated for much longer. Over time, the body's cells can become less responsive to that constant signal. That's one explanation the doctor gives for how insulin resistance develops. Why prediabetes matters. One of the most important messages not to ignore prediabetes. Many people hear the word and think, it's not diabetes yet, so I don't need to worry. The expert sees it differently. Prediabetes is an opportunity. It's your body's way of saying, pay attention now. Instead of waiting until blood sugar climbs even higher, this is the time to improve daily habits, become more active, and work with your healthcare provider on a plan that's right for you. Another less common form of diabetes, the doctor also mentions another type sometimes seen in clinical practice. In some people, repeated inflammation or damage to the pancreas, such as pancreatitis, can reduce the pancreas's ability to produce insulin. As more pancreatic tissue is damaged over time, insulin production may continue to decline. While this isn't the most common type of diabetes, it highlights an important point: a healthy pancreas is essential for healthy blood sugar regulation. Key takeaway: here's the big picture. Asterisk type 1 diabetes asterisk happens because the pancreas can no longer produce enough insulin. Asterisk type 2 diabetes asterisk usually begins with insulin resistance. At first, the pancreas produces extra insulin to compensate. Over time, that extra workload can become too much, and blood sugar begins to rise. And before type 2 diabetes develops, many people pass through a stage called asterisk prediabetes asterisk, a valuable opportunity to recognize the problem early and make meaningful changes. So now that we understand how diabetes develops, here's the next question: if processed foods and hidden carbohydrates play such an important role, what everyday foods could quietly be pushing blood sugar higher without people realizing it? That's exactly what we'll cover next, including breakfast mistakes, hidden sugars, and why some foods that seem healthy may not always be the best choice for everyone. Now that we understand how type 2 diabetes develops, let's talk about something that surprises almost everyone. It's not always the obvious desserts or candy that cause the biggest problems. According to our expert, some of the foods people eat every single day, and even think of as healthy, can add up to a much larger carbohydrate load than they realize. The key message here isn't to fear food. It's to understand what's on your plate and how it affects your metabolism. The two foundations of better blood sugar. Before talking about specific foods, the doctor emphasizes something important. Managing blood sugar isn't only about diet. It's also about asterisk physical activity asterisk. Today's lifestyle is very different from what it used to be. Many of us spend hours sitting at a desk. We work on computers. We scroll on our phones. We work from home. We drive almost everywhere. In other words, we are moving less than ever before. Less movement means our bodies use less energy, making healthy eating habits even more important. The morning habit many people never question. Let's start with breakfast, or actually, what happens even before breakfast. For many people, the day begins with coffee or tea. And with that drink often comes a couple of cookies. It feels harmless. After all, they're small. Some people even choose plain crackers or lightly sweetened cookies because they assume they're the healthier option. But according to the doctor, this is where hidden carbohydrates can easily sneak into the diet. The focus shouldn't only be on the teaspoon of sugar added to your coffee or tea. It's also important to consider the carbohydrates in the foods eaten alongside it. Those carbohydrates are eventually broken down into glucose. That's why the doctor encourages people to look beyond foods that simply taste sweet. Sugar isn't always sweet. Here's an important idea from the interview. Not every food that raises blood sugar tastes sugary. Many starchy foods eventually become glucose after digestion. That's why simply asking, "Does this taste sweet?" doesn't always tell the whole story. Instead, understanding the carbohydrate content of foods gives a more complete picture. Why breakfast matters. Breakfast sets the tone for the day. After an overnight fast, your metabolism is beginning to wake up. Your liver is active. Your pancreas is preparing to respond to your first meal. Whatever you eat now influences the metabolic response that follows. That's one reason breakfast deserves extra attention. What about parathas? The discussion then turns to one of the most common breakfasts in many households. Parathas. The doctor explains that several ingredients commonly found in a traditional potato paratha contribute carbohydrates. The wheat flour contributes carbohydrates. The potato filling also contributes carbohydrates. For someone whose blood sugar is already well controlled, this may fit differently than it would for someone with poorly controlled diabetes. That's an important distinction the expert keeps repeating throughout the interview. His advice is based on the individual's metabolic health, not one universal rule for everyone. But it doesn't taste sweet. One of the biggest misconceptions discussed is the idea that only sweet foods affect blood sugar. Many people avoid desserts while feeling perfectly comfortable eating large portions of starchy foods because those foods taste savory. The doctor encourages people to remember that many carbohydrate-rich foods are eventually converted into glucose after digestion. So whether a food tastes sweet or not doesn't always predict its effect on blood sugar. What about bread and flatbreads? Lunch often follows the same pattern. Many meals are built around breads or flatbreads. Again, these foods don't taste sugary, but they do contain carbohydrates. The interview encourages viewer to think about the total amount of carbohydrates eaten throughout the entire day rather than focusing on just one ingredient. That's an important shift in thinking. Instead of asking, "Can I eat this one food?" it becomes, "How much carbohydrate am I eating across all my meals?" Lentils, chickpeas, and beans. Next comes a topic that often surprises people. Foods like lentils, chickpeas, kidney beans, and similar legumes are widely known as sources of plant protein. The doctor agrees that they do provide protein. However, he also points out that they contain carbohydrates. His message isn't that these foods are bad. Instead, he's explaining that for someone with poorly controlled diabetes the carbohydrate content may also need to be considered. Throughout the interview, he repeatedly reminds viewer that this discussion specifically focuses on people whose blood sugar remains significantly above target. He also notes that someone who is physically active, metabolically healthy, or does not have diabetes may have very different nutritional needs. That's why personalized medical advice is so important. It's about context. One of the strongest themes throughout the interview is context. The same food may affect different people differently. A young athlete, someone who exercises every day, someone without diabetes, someone with prediabetes, someone whose HbA1c is well above target. These are not identical situations. That's why blanket rules rarely work for everyone. Processed foods add up quickly. The doctor also discusses how easy it is for processed foods to become part of our everyday routine. Packaged snacks, convenience foods, fast food, ready-made meals. Individually, each one may seem small. But over the course of an entire day, and then an entire week, they can contribute a substantial amount of refined carbohydrates. Many people don't realize how quickly those foods add up. Looking at the whole day instead of judging one single meal, the interview encourages viewers to step back and look at their entire eating pattern. Ask yourself, what did I eat this morning? What did I snack on? What did lunch look like? What did I drink? What did I eat after dinner? Sometimes the biggest improvements come from recognizing patterns rather than eliminating one specific food. A balanced perspective. The doctor is careful not to present one-size-fits-all advice. He isn't saying everyone should permanently eliminate certain foods. Instead, he explains that recommendations depend on the person's health status, blood sugar control, activity level, and overall metabolic condition. For someone with poorly controlled diabetes, temporary dietary adjustments may be appropriate while working toward better blood sugar control. For others, the approach may be different. That's why individualized guidance from a qualified healthcare professional is so valuable. So far we've talked about hidden carbohydrates in everyday meals. But now we're about to move into one of the most debated topics in nutrition: fruit. Many people assume that because fruit is natural, it can be eaten without limits. But is that always true? What about fruit juice? Honey? Jaggery? Dates? Are natural sugars really different from regular sugar when it comes to blood glucose? Fruit, natural sugars, early warning signs, and the role of sleep. We've talked about hidden carbohydrates in everyday meals. Now let's tackle one of the biggest nutrition debates: are natural sugars really different? Many people believe that if something is natural, it must automatically be good for blood sugar. But according to our expert, the answer isn't always that simple. As with many things in nutrition, asterisk context matters. Is fruit always a healthy choice? Fruit contains vitamins, minerals, fiber, and beneficial plant compounds. Those are all important nutrients. However, fruit also contains natural sugars and carbohydrates. The doctor explains that whether fruit fits into someone's diet depends largely on their current metabolic health and blood sugar control. For someone who is physically active, metabolically healthy, and does not have diabetes, fruit may fit into a balanced eating pattern very differently than it would for someone with significantly elevated blood sugar. That's why he avoids making blanket recommendations. Instead, he looks at the individual. Why portion size matters. Another important point from the interview is that asterisk portion size matters. Sometimes people assume that because fruit is healthy, more must be better. But eating one serving of fruit is very different from eating several servings at once. The doctor encourages people to pay attention not only to what they're eating, but also how much. Fruit juice. Why it can be different. Now let's talk about fruit juice. This surprises many people. When fruit is turned into juice, much of its fiber is removed. At the same time, it becomes much easier to consume several pieces of fruit in just a few minutes. Think about it. Drinking a large glass of orange juice may contain the juice from multiple oranges. Most people wouldn't sit down and eat that many whole oranges in one sitting. That's one reason the doctor encourages people with poorly controlled diabetes to be especially mindful of fruit juice. What about apples, oranges, and other fruits? During the interview, the doctor uses examples such as oranges and apples to explain that fruits contain carbohydrates. Again, his point isn't that these foods are unhealthy. His point is that the total carbohydrate load matters especially for people whose diabetes is not well controlled. Throughout the conversation, he repeatedly reminds viewers that his recommendations are tailored to the person's blood sugar levels, medical history, and overall metabolic condition. Are there fruits he sometimes recommends? Yes. The doctor explains that, depending on the individual, he may sometimes allow smaller fruits, such as kiwi or guava. His reasoning isn't that these fruits are magic foods. Instead, he notes that their serving size is generally smaller, making portion control easier. This is another example of individualized nutrition rather than one-size-fits-all advice. The natural sugar myth. Now let's move to another common misconception. Honey, jaggery, dates, brown sugar, coconut sugar. You've probably heard someone say, it's natural, so it's healthier than regular sugar. The doctor challenges that idea. He explains that, regardless of the source, the body ultimately processes these carbohydrates into glucose. That's why he advises people with poorly controlled diabetes to be cautious with these sweeteners as well. One reason this becomes a problem is perception. When people believe something is healthy, they often eat much more of it. The result? The total amount consumed may end up being greater than they intended. His message is simple: don't let the word natural automatically convince you that unlimited amounts are appropriate. Protein bars and hidden sweeteners. The interview also touches on products marketed as healthy. Some protein bars and snack products advertise that they're sweetened with dates or other natural ingredients. The doctor says this can sometimes give people a false sense of security. Instead of relying on marketing claims, he encourages people to understand what's actually in the product and discuss dietary choices with their healthcare provider if they have diabetes. Early warning signs most people ignore. Now that we've covered food, let's talk about something just as important. How do you know diabetes might be developing? The challenge is that the earliest signs are often subtle. Many people explain them away. I'm just getting older, I've been busy, I didn't sleep well, but sometimes these small changes are your body's way of asking for attention. The very early signs according to the doctor, one of the first changes many people notice is persistent fatigue Not just feeling tired after a long day. Feeling unusually low on energy even when nothing obvious seems wrong. Some people also notice they become very sleepy after meals. Instead of feeling energized after eating, they struggle to stay awake. Others notice a feeling of heaviness or fullness after meals. These symptoms are not unique to diabetes, but when they occur consistently, they shouldn't be ignored. The more recognizable symptoms as diabetes progresses, some symptoms become much easier to recognize. The doctor highlights 3 classic warning signs. 1. Frequent urination, needing to urinate much more often than usual. 2. Increased thirst, feeling thirsty much of the time, even after drinking fluids. 3. Increased hunger, feeling unusually hungry, even though you are eating regularly. These are among the most common symptoms people associate with diabetes. Blurry vision, another early symptom, can be blurred vision that comes and goes. The doctor explains that when blood sugar rises, changes in the eye's lens can temporarily affect vision. Some people notice blurry vision for a short time, only for it to improve later. Even though it may seem temporary, it's still worth discussing with a healthcare professional. Slow healing cuts. Have you ever noticed a small cut or scrape taking much longer than expected to heal? The interview identifies slow wound healing as another warning sign that shouldn't be ignored. Whether it's a small scratch, a shaving cut, or an insect bite, wounds that consistently heal slowly deserve medical attention. Unexpected weight loss. Here's another symptom many people don't expect. Losing weight without trying. Although obesity is common in type 2 diabetes, the doctor explains that some people still experience significant, unexplained weight loss before diagnosis. Whenever weight loss happens without a clear reason, it's important to speak with a healthcare provider. Why sleep deserves more attention. After discussing food and symptoms, the conversation shifts to something many people underestimate. Sleep. The doctor calls sleep one of the most overlooked parts of metabolic health. Think about how you feel after a poor night's sleep. You are tired. You have less energy. It's harder to concentrate. You may even crave more food. That's why he encourages people not to treat sleep as optional. According to the discussion, aiming for about 7 to 8 hours of sleep each night supports overall health. He also emphasizes that maintaining a consistent sleep schedule may be beneficial whenever possible. Respect your body's clock. The doctor explains that our bodies operate on natural daily rhythms. Whenever possible, going to bed at a consistent time and allowing enough time for sleep supports those natural rhythms. He acknowledges that shift workers and others with demanding schedules may not always have that flexibility. But whenever circumstances allow, making sleep a priority is one of the lifestyle habits worth protecting. Key takeaways so far: we've learned that managing diabetes isn't just about avoiding candy or desserts. It's about understanding total carbohydrate intake recognizing that natural doesn't always mean unlimited, paying attention to early warning signs, and giving your body the rest it needs. But there's another major factor that often flies under the radar. Stress. Can chronic stress actually affect your metabolism? Does family history mean diabetes is inevitable? And which blood tests can detect problems before diabetes becomes severe? Stress, genetics, and the most important, diabetes tests. We've talked about food, hidden sugars, early warning signs, and sleep. Now let's discuss 2 factors that many people worry about the most: stress and genetics. Can stress actually raise your risk of diabetes? And if your parents had diabetes, does that mean you're destined to get it too? Let's break it down. Can stress affect blood sugar? According to the doctor, the answer is yes. When you are under stress, whether it's emotional stress, work pressure, financial stress, or even physical stress from illness, your body releases a hormone called cortisol. Cortisol is part of your body's natural fight or flight response. In short bursts, that's helpful. But when stress becomes chronic, cortisol levels can stay elevated for long periods of time. The doctor explains that this can contribute to insulin resistance making it harder for the body to regulate blood sugar effectively. The belly fat connection. One of the most important points from the interview is that chronic stress is often linked with central obesity or excess fat around the abdomen. This type of fat is considered more concerning than fat stored in other areas of the body because it tends to collect around internal organs. The doctor describes this as visceral fat fat around and even inside organs such as the liver and pancreas. Why does that matter? Because fatty liver and fatty pancreas are both associated with worsening metabolic health and insulin resistance. So if someone is dealing with high stress, poor sleep, little physical activity, frequent processed foods, and increasing belly fat, those factors can work together and significantly increase the risk of metabolic problems. Does family history mean you'll get diabetes? This is a question almost every doctor hears. My mother had diabetes, my father had diabetes, does that mean I will definitely get it too? The doctor's answer is reassuring. No. A family history increases your risk, but it does not guarantee that you will develop diabetes. He explains that type 2 diabetes has a significant genetic component, but lifestyle and metabolic health still play a major role. In other words, your genes may load the gun, but your daily habits often influence whether the trigger gets pulled. That means improving your diet, staying active, sleeping well, managing stress, and maintaining a healthy weight can all help reduce your risk, even if diabetes runs in your family. The 3 basic tests everyone should know. Now let's talk about testing. If you want a simple, affordable starting point, the doctor recommends 3 basic blood tests *. These tests are commonly available and give a good overview of your blood sugar status. 1. HbA1c, A1c, this is the most important long-term test. It shows your average blood sugar over the past 2 to 3 months. Because it reflects a longer period of time, it's usually more reliable than a single blood sugar reading taken on one day. A1c ranges below 5.6%, right pointing arrow normal, 5.6% to 6.4%, right pointing arrow prediabetes, 6.5% or higher, right pointing arrow diabetes. The doctor emphasizes that prediabetes is not a life sentence *. It's an early warning sign and often a stage where lifestyle changes can make a major difference. 2. Fasting blood sugar. This test is done after an overnight fast. Diagnostic range, ** 126 mg per deciliter or higher *, right pointing arrow diabetes for people who already have diabetes and are trying to keep it under control. The doctor says the usual target is below 130 mg per deciliter. He notes that around *, 115 mg per deciliter is considered a very good target *, but staying under 130 mg per deciliter is the general treatment goal used in many guidelines. 3. Post-meal, postprandial, blood sugar. This test is done * 2 hours after eating *. Diagnostic range, * 200 mg per deciliter or higher *, right pointing arrow diabetes for people already diagnosed with diabetes. The target is usually below 170 mg per deciliter. The doctor explains that these targets are designed to reduce the risk of complications affecting the kidneys, eyes, heart, and other organs. The test most people never hear about. This was one of the most interesting parts of the interview. The doctor says that if someone wants to detect metabolic problems even earlier than prediabetes he often recommends a fasting insulin test Many people have never had this test done. Why is it useful? Because insulin levels may become elevated years before blood sugar becomes abnormal Remember what we discussed earlier. In the early stages of insulin resistance, the pancreas produces extra insulin to keep blood sugar looking normal. That means a person can have *normal fasting glucose normal A1C but *high fasting insulin according to the doctor. This can be an early warning sign that the body is becoming insulin resistant. What insulin level is ideal? The doctor explains that many laboratories list values up to around *25 as normal, but he prefers a much lower range. His practical interpretation, *210 right pointing arrow optimal above 10 right pointing arrow early warning sign, *15-16 right pointing arrow suggests increasing insulin resistance above 20 right pointing arrow more concerning. He also stresses that *1 abnormal result should not cause panic. If the level is elevated, it should be repeated and interpreted in the context of body weight, waist size, blood sugar levels, and overall health. How often should you test? This is another area where people get confused. If you already have diabetes and your numbers are well controlled, A1C every 3 months. If your diabetes is poorly controlled, A1C 9%, 10%, 11%, or higher, the doctor says he often checks blood sugar more frequently at the beginning so he can see whether treatment and lifestyle changes are working. If you have prediabetes, A1C every 3 months, but he makes an important point, don't just keep testing and doing nothing. Prediabetes is a chance to take action. The treatment targets that matter once someone is diagnosed with diabetes. The goal is not simply to bring the numbers down a little. The doctor is very clear about the target. Treatment goals. A1C below 7%, fasting blood sugar are below 130 mg per deciliter, 2-hour post-meal blood sugar below 170 mg per deciliter. He explains that reaching these targets helps lower the risk of complications involving the kidneys, eyes, heart, liver, and nerves. And importantly, he says these goals can be reached through a combination of medication when needed, nutrition changes, physical activity, weight management, better sleep, stress reduction. The golden opportunity of prediabetes. I love the way the doctor describes prediabetes. He says it's almost like your body is giving you a warning before serious damage occurs. At this stage, many people can improve their metabolic health by losing excess weight, reducing ultra-processed foods, increasing daily movement, exercising regularly, improving sleep, managing stress. This is the time to act, not after years of uncontrolled blood sugar. What's coming next? So now we know, how stress affects metabolism, why belly fat is important, how genetics influences risk, which blood tests matter most, and what targets doctors aim for. But the next question is the one everyone is waiting for. What should a person with diabetes actually eat? The doctor has a practical system he calls the *5-plate protocol *. And unlike rigid meal plans, this method is designed to work with different cultures, food preferences, and lifestyles. Can diabetes be reversed? The 5-plate protocol and AMP. Final takeaways. After everything we've covered, there's one question almost everyone wants answered. Can diabetes actually be reversed? The doctor says this is one of the most common questions he hears, and it's also one of the most misunderstood. The word reversal, is popular online, but medically, he prefers a different term. Remission. Here's what that means. If someone is able to maintain an HbA1c below the diabetes range for at least 3 months without diabetes medication that is considered diabetes remission The goal isn't just to see your numbers improve a little. It's to reach healthy target levels and maintain them safely under the guidance of your healthcare team. A story that shows what's possible. The doctor shares the story of one of his patients who came to him with a blood sugar level of over 500 mg per deciliter. She was frightened. After reading information online, she believed her situation was hopeless. But instead of giving up, they created a treatment plan. It included appropriate medication, increased physical activity, and the doctor's structured *5-plate protocol adapted to fit her cultural food preferences. She followed the plan consistently. Over the following months, her blood sugar improved dramatically, and her HbA1c came down into the target range. The doctor's message isn't that every person will have the same outcome. His point is that meaningful improvement is often possible when treatment, nutrition, activity, and regular follow-up all work together. The 5-plate protocol, one of the doctor's signature approaches, is what he calls the asterisk 5-plate protocol asterisk. Rather than focusing on one superfood or one restrictive diet, the idea is to build meals around balanced food choices. The exact plan should always be personalized, but he explains the overall approach is helping people make healthier food decisions that they can continue long-term. Instead of chasing quick fixes, the focus is on creating habits that support better metabolic health day after day. Small changes add up. You don't have to change everything overnight. Small, consistent improvements often make the biggest difference. Move your body a little more. Pay attention to portion sizes. Prioritize quality sleep. Take your medications exactly as prescribed. Keep up with your follow-up appointments. And don't ignore early warning signs. These habits may seem simple, but over time they can have a meaningful impact on your overall health. Focus on progress, not perfection. The doctor also reminds viewers not to lose hope if they don't see instant results. Managing diabetes is a long-term journey. Some people improve quickly. Others need more time. The important thing is to stay consistent and continue working with qualified healthcare professionals to adjust your treatment plan as needed. Every healthy choice you make today is an investment in your future health. Final thoughts: if there's one message to remember from this entire conversation, it's this: diabetes is much more than a blood sugar problem. It affects your entire metabolism and, if left unmanaged, can impact your heart, brain, eyes, kidneys, nerves, blood vessels, and many other parts of your body. The good news is that early awareness, regular monitoring, healthy lifestyle habits, and appropriate medical care can make a real difference. Learning how diabetes works gives you the power to make informed decisions before complications develop. Knowledge truly is one of the best tools you have. One memorable takeaway: don't wait for diabetes to control your life. Start making small, healthy choices today, because the habits you build now can help protect your health for years to come. Here on Vitality Health Works we're committed to bringing you clear, practical, science-based health advice that helps you make smarter decisions for a healthier life. Thanks so much for watching, and we'll see you in the next video.
Thanks for watching Vitality Health Works. Small, science-backed habits build lasting health. Start today. If this helped, like and subscribe and turn on notifications. See you in the next video.